Hello, PsychU community, and welcome to today's webinar featuring Drs. Mauricio Tohen and Joseph Goldberg, titled A Shot for Bipolar I Disorder, Identifying Appropriate Patient Profiles for Maintenance Therapy with a Long-Acting Injectable Medication. Really an appropriate discussion as today is World Bipolar Day and also Doctors Day. So really thank you for joining us today. I am Dr. Fatima Sadat, Senior Medical Science Liaison for Otsuka Pharmaceutical Development and Commercialization Incorporated. I'll be serving as the moderator for today's exciting discussion. I previously had the opportunity to sit down with Drs. Tohen and Goldberg to talk about the concept of using a long-acting injectable medication in patients with bipolar disorder. Because this kind of maintenance therapy may not be thought of as much when clinicians are considering treatment options in their patients, I invited Drs. Tohen and Goldberg back to give us some more insight. So really, let's get started. Let's take a look at a previous clip from our last discussion.
Challenge that we have is that it's very difficult to detect non-adherence. Is the patient really taking the medication? The patient might say, well, I am, but sometimes I am doesn't really mean full adherence. So that's another challenge that we have. Is non-adherence being full?
So, Dr. Tohen, you mentioned that medication non-adherence is really difficult to detect, even if an individual is trained to do so. Can you discuss how you go about detecting non-adherence with your patients? Do you look at polypharmacy? Do you have specific questions you ask? Maybe do you go and have a discussion with family members? What does that conversation look like?
Let's first keep in mind that the best predictor of relapsing in bipolar disorder is non-adherence. That is the number one reason. So anytime that we have a patient who was doing well, was taking the medication as prescribed, and the patient just relapsed, the first question is, was he or she taking the medication or not?
You know, a first episode of mania, in my view, and perhaps in Dr. Tohen's as well, is a unique thing. We're establishing the diagnosis. We want to clarify that it's not a secondary mania due to some underlying medical condition or substances. We want to take a longitudinal history and determine the likelihood that this is enduring recurrent bipolar disorder based on family history, based on age and onset, course over time. So a first episode, and also certain medicines inherently work better in a first episode than in later episodes. So a first episode is kind of special. I don't necessarily feel inclined to think about an LAI necessarily on a first episode.
So really, Dr. Goldberg, in the clip we just played, you mentioned your objective with any first episode manic patient is for them never to have a second episode. In addition to family history, what other factors might warrant an LAI treatment option for a first episode patient?
So teachers of mine taught me the patient will never again have their first mania, and it's a window of opportunity to really intervene before the new normal sets in, and someone who's gone on to have multiple episodes or a downhill course over time is a much harder patient to treat. So for all those reasons, we'd like to get in as soon as possible to educate, to make clear what they're up against, and to try to give a sense of how we can minimize or forestall the chance of relapses.
We've been talking about non-adherence. My experience, and also it's been reported in the literature, that the time patients are the most non-adherent to treatment is unfortunately in the first episode. In a way, for some patients, it's because they haven't learned a lesson. What do I mean by that? So you have a patient with the first episode of mania, first episode of psychosis. In most cases, the recovery is ad integrum. That means there are no residual symptoms. So the patient recovers, I'm back to my usual self. But unfortunately, all medications have side effects. So the patient will ask himself or herself, I'm doing well, I'm gaining weight, or having any other side effect. Why should I take the medication? I'll be fine. They stop the medication. Actually, recently I've had 2 patients, first episode psychosis. It appeared to be affective psychosis. They got well, stopped the medication, readmitted, and then again, a second time, stopped the medication, readmitted. And it was not until the third hospitalization within 3 to 4 months that the patient realize that stopping the medication has terrible consequences.
So we saw Dr. Tohen discussing how educating the patient early and inquiring about their goals is a priority. Dr. Goldberg, let's see how we would have a conversation. Let's say that I'm your patient. I am a young individual. I'm in college, maybe my first year. This is my second relapse. I'm completely shell-shocked when I come see you on the fact that 3 months ago I was in school, now I'm not. How do you go about addressing my concerns as a patient? We'll actually have you role play and have our audience take a look at what that looks like.
So Fatima, it's really good to see you. I know you've been having a really hard time. Tell me where you're at right now. How are you doing?
You know, I'm not doing good, Dr. Goldberg. I just can't believe I'm in this situation again. I thought that one episode I had, that was it. I really just want to get my life back on order, get back to school and where I was before.
So at this point, I think what we want to do is really make a team effort to figure out what you want to see happen in the short term, in the long term. The illness is the enemy. You and I are going to put on the grease paint and fight it, right? So you want to get back to school. I want to make a clear sense, your goals, back to school. What else stands between us and success against the enemy? What are the obstacles you can point to?
You know, my medication, the reason I stopped taking it, I was having some side effects. I don't want to have those side effects. I'm young, I'm gaining some weight. So that definitely is an issue. And it's really hard for me to just believe that I'm going to have this condition forever.
Okay. So it's hard to predict forever, but I can tell you this, if we're successful in helping you find something that will contain the illness and put it into remission, that could help you get back to school. And if we're really thoughtful about this, we'll try to find something that will reach those goals while minimizing the side effects that you're concerned about. So let's craft, you and me together, let's craft a regimen and make sure that it fits. It's like I'm your eye doctor putting on lenses and asking you, how can you see? Or is this what you're looking for? Does it make you happy? And you're going to tell me if this fits or doesn't fit.
You know, Dr. Goldberg, my mom is here with me today, and she really is concerned. It's been 2 weeks since I've been discharged from the hospital. I'm not getting any better, and she's really worried about me. Can you just talk to her for a second on what you would say to, what you're going to say to her to make her feel better?
I can, but you know, luckily I work as a team, and I have this really wonderful psychiatrist colleague that's just outstanding in talking with family members. Let me see if he's available. Let me see. Dr. Tohen, would you have a moment to join us and speak with Fatima's mom?
It'll be my pleasure, Dr. Goldberg. So, Mrs. Sadat, as we know, Fatima has trouble taking her medication. You've mentioned to us that in the past, when she had to take antibiotics and she had to take them for 10 days, she would just take them for 3 to 4 days. So I think that, as Dr. Goldberg mentioned, we should put a team together, so a collaborative approach. What would you recommend, Fatima, Mrs. Sadat, in terms of the medication? Should she take a pill? Should she take an injection? What would be your suggestion?
You know, she wasn't really good about taking her pill, and she was off at college. I'm not sure how long she's going to be home now. So what other options are there? I'm not really familiar.
Well, yes, the same. We can give him the same medication that she is taking now by mouth. We could give exactly the same medication with an injection, and that injection would be repeated every month. So she doesn't have to remember taking the medication every day, just to remember to come to the shot clinic and get her shot. You think that would work well for her?
Yeah, I mean, she doesn't like needles. Who does? But the fact that, you know, it's once a month, as a parent, I'd feel a lot better knowing that it's on board.
Mm-hmm.
And
Fatima, what do you think? Let's ask Fatima.
Yeah, I mean, I'm young and I don't really like needles, but I'm gonna have to talk to my mom and think about that. But it might be better, especially aligning with what I want in the future.
The one other aspect of this that I think of is peace of mind. I'd wonder if both Fatima and her mother would in any way feel more of a sense of peace of mind, not wondering, did I forget to take a medicine? What if I'm going to go out and I'm going to be away? And I'm really worried that I'm going to have a shaky experience if a relapse comes along, and I want to do everything I can to minimize that. Would it help peace of mind to think of this as an option and just to know all about it?